Here we are, another time around the sun, and we're back at the ASH annual meeting, the 2023 edition. And like all previous meetings, it's been a flurry of activity, particularly for patients with MPNs and the research that surrounds these diseases. And so it's been a very exciting time for all of us, and also a time to kind of reflect on the advances over the last year and look forward to things to come. So always an exciting time to be here at the annual meeting. This year it's in sunny San Diego, and did manage to get some really, really good tacos last night, so could check that off my list. But more importantly is the great research that's being presented here, in particular for, again, patients with MPNs. And of course, top of the list there is the Transform and Manifest trials. The first upfront studies done in myelofibrosis with combination therapy. Absolutely mind-blowing considering where we were just 4 or 5 years ago with the treatment of myelofibrosis. So a very exciting time. 2 big trials. Just the fact that they were completed is a big deal, let alone having met the primary endpoint for both studies. And so we're very excited to see these data presented in the oral sessions. Unfortunately, they're at different oral sessions, which is kind of fun. They're being presented in somewhat isolation, so it gives us a lot of space in between to talk about it amongst the different MPN specialists. So actually, is kind of reinvigorated the group, I would say. There's a lot of other really exciting science being presented, a lot of preclinical studies with new drugs that are about to launch in clinical trials or have recently launched in clinical trials, looking at some similar things like pelabresib in the Manifest-2 trials, a BET inhibitor. There are other BET inhibitors being developed, and there's some really exciting preclinical data from some of the newer versions of that type of medication. There's some data being presented on new JAK inhibitors even. Even though we have 4 FDA approved for the treatment of myelofibrosis, there are new ones being developed that have kind of different tricks up their sleeves, if you will. In addition, everyone's excited to learn more about the harnessing of the immune system to treat these diseases. So in particular, monoclonal antibodies, like the one that's being developed by Incyte, as well as bispecific antibodies, and even vaccine therapies. And so, really that represents the future of the treatment of MPNs going forward. Not to ignore ET and PV, but there's been a lot of work this year presented looking at thrombosis risk, again, being a very common consequence of those diseases. So trying to understand in a more precise and granular way who's at high risk for blood clots, that way we can intervene in those patients' trajectory to make their lives better. So a ton of science, and it's not just the actual data being presented at the meeting, but it's everything that's happening on the sidelines, like the discussions between the investigators and the industry partners to really develop the concepts of new trials coming through. The discussion amongst the investigators themselves and docs who care for patients with MPNs. I mean, we have a lot of kind of off-the-cuff meetings, dinners, or just walking with each other in the hallways, just chatting about things. So really, it's just, you would say, to use a medical term, a bolus of enthusiasm into the MPN community every year. And so that's what, to me, makes the meeting so exciting. That, and along with really the advancements. And there's just been such cool things presented. It's not necessarily in the MPN space in full force, but there was a really nice abstract presented looking at the use of artificial intelligence to distinguish between ET and prefibrotic myelofibrosis. And I think this represents the arrival of a new technology into the care of patients with MPNs, which is very exciting. It's I kind of mentioned in a press briefing that I did for the American Society of Hematology, but it's really exciting to have these technologies come to the forefront. And some people mention these things as revolutionary technologies, and I was really quick to point out that it's not the technologies that are revolutionary. It's really actually the people that are revolutionary. The technologies that's just tools, but without the creativity and perseverance of the people applying these technologies, these things would never come to life. So I would say that the investigators working behind these trials are really revolutionaries. And so when you do meet with your MPN specialist in the upcoming months, certainly ping them for what they thought was exciting. And I would advocate for thanking them for all that they do to bring new therapies to all the patients who are living with MPNs out there in the country. And so with that, again, it's been a super exciting annual meeting so far. We're right in the midst of it right now. We got a few more hours to go until we kind of wrap things up and all head back to our respective hometowns and institutions. But again, it's just amazing every year to see just this absolute injection of life and vitality into the field to carry us through the cold winter months to come.